Let's talk about the DHA statistics. DHA statistics are mandatory to send to DHA every month for all the activity of the dental clinic. It's not separate patient, practitioner by practitioner. It is the whole dental clinic data that needs to be sent. And this is based on the circular number 162. What they say in this circular that this activity must be linked to the number of patients, inpatients, outpatients, emergency. In dental clinics, we never have inpatients. We have outpatients and emergency. We need to classify this patient. We need to know who is coming in emergency and who is coming as an outpatient. The age, the gender, the country of permanent residence, the Emirates of residence, the nationality, the type of treatment provided, and the medical spent in AED. So we have much more than that in AccuDent. Not only we have what is required, but we have more because we need to be compatible with insurances, with DHA, and with NABID. And all these entities are not asking for the same thing. One is asking for gender, one is not asking for gender. One is asking for the date of birth, NABID is mandatory, and in insurance, it's not mandatory in some cases. So based on this, we need to add a certain number of things. Let's see what we have. We have the title, we have the gender, the first name, the last name, and then we have the mobile number. All the mobile number must be done following this format. The email must be verified. If not, when we are going to send an email, you have good chance to have your email going to the spam of the patient. So email must be verified. I will explain to you in another movie how do we select the emails and we validate the emails. The date of birth, which is mandatory by NABID, and this is based on this format: date, month, and year. The option out, okay, this is mandatory for NABID, and we will not use that. I will explain to you in another movie how it's working. The state of residence, based on the list of the state in the Emirates, the nationality, the region, the file number, the document type, the document ID, the practitioner who is selected to treat this patient, and the stat search. Stat search will be on non-Emirati, Emirati, or international patient. This means the visitors. And residential address. All this is what we have. So you see that we have more than what is needed for DHA statistics, for example. And we store more about the insurance. The insurance, we have the expiry date, again, date, month, year. The name of the insurance, we have about 25, but we can add more if you need. Insurance number, insurance name, insured date of birth, and insured nationality. If you don't want to write all these things, you just click here. If the patient is the same as the insured, all this will be filled automatically. And we save time when we fill a new patient's file. What we need also is the country and nationality. And this is based on this list in English, in Arabic, and with a number. They need us to add the number. So every time you make a line of procedure, you need to search and find which number is referring to the patient's country. So for that, you will not need to do it manually. In AccuDent, this is done automatically. When a patient is born, is from Australia, automatically this number will be selected. You have nothing to do. All this is done automatically. In the statistics, the type of treatments and the diagnosis are based on DHA list that we need to select. We have the CPT codes for the procedures and the ICD codes for the diagnosis. And we need to find in the big list of more than 600 or 800 different codes, we need to find which are the codes dedicated to dentistry. And there are only few, 1, 2, 3, 4, 5, 6, 7, okay? So we've been looking in this big list and we have been finding these 7 different statistic specialty linked to dental clinics. So once again, this is linked to all procedures. And when you click on a procedure, you will get the selection of the stat specialty and you will get that automatically implemented in the statistics. Nothing to do manually once again. The format of date which is required in our system is day, months, and year, okay? In most of the program here in Middle East is like this, but what DHA is asking in the training movie is to make months, day, and year, like in US. So all this is taking a lot of time, and we are making a lot of mistakes when we include all that to submit that to DHA. So because of that, because of understanding that, we've been doing the things in a different way. First of all, there are 5 different statistics to send every month based on the whole activity of the clinic. The statistics number 15 is based on Emirati and non-Emirati, and this is done by analytical list of procedure and by age. We are going to see that in details. The statistics 37, 38, and 39 are a list of procedure done for Emirati patients, visitors, and non-Emirati. Let's go and let's check how we can do now using AccuDent. So all procedures are linked to the required analytical DHA list. And this is the list. We have been implemented this list, and we will link all the procedure that needs to be linked to one of these procedures. And this will be very helpful when we have to edit the statistics. So this is for statistics number 15. It is not linked to number 36, 37, and 38. All the procedures are linked in 15 to the age of the patient. So there is a from 5 to 9, from 10 to 14, etc., male and female. So we have the age, we have the gender, we have the date of birth, and all these things will be automatically calculated. You don't have to calculate anything else. So how to do that? First of all, we export the Excel file from DHA portal. Then we select and copy few cells. Then we work in AccuDent in statistics, and we select what we need to edit. In the AccuDent Excel file, we paste what we've been selected at the step 2. We upload and we submit to DHA. Let's go. I'm explaining how we do. Step 1. So when you go to the DHA portal, you are in 15 dental patient and treatment by nationality, sex, group, age, and type of treatment. We are going to go here to download the Excel template to be used for data. We are not going to use this one to send it. We are going to use one done exactly in the same way on AccuDent. But in this, we will need to select some things which are coming from DHA only. So you know where we are, we download, and when we open this Excel file, we click on that to select non-Emirati or Emirati. This is number 1. Number 2, we select all these cells together, we select, and we copy. Now, what we can do, we can delete the Excel file received from DHA because we don't need it anymore. Why we do not need it? Because in step 3, we go to AccuDent, we go in the statistics, so we have the name of the clinic, we have the year, we have the month, we select what we want, 15 for example, non-Emirati or Emirati, and we generate. Generating that, we generate an Excel file, which is exactly the same as the one that we received by DHA. But this is where we are going to select all the cells together, and we are going to paste the few cells which are selected. When we have this, we can upload we can save, and we can upload the data to the report using Excel template. So now we have this template, we have nothing to change, it's all done automatically. So we browse, we select that, and we send that to DHA, and then we wait, and 2-3 days after, we will receive the approval of what we've been sending. So you see how simple it is and how fast it is to do like this. Let's go. Then you can do exactly the same for all the stats you need to send. I have been showing to you how to do on number 15, but it's the same exactly on number 37, 38, and 39. The average time to send an Excel file will be 2 minutes if you are slow. So it's very easy to take care of the statistics. No need to spend time on that, and no mistakes. No risk of mistake. So now let's go and try on your case. I will make a movie so